Let's now talk about lipids and lipid profile. So we've got the standardized cholesterol panel that you can get from your physician. Within that would contain your total cholesterol, your triglycerides. You'll see something called LDL. You'll see something called HDL. And if you've got a really great practitioner, you may see something called ApoB. Now, we know that having, well, actually, I don't know. I see so many things, but I'm under the impression that we want to kind of keep a low LDL and ApoB profile just to avoid cardiovascular disease, that plaque buildup that may cause atherogenic plaques, or even cause maybe a stroke from occurring. I know that the Journal of Neurology released an article. I think it was like a research study around 2 years ago stating that LDL now in midlife for women is a risk factor for Alzheimer's disease or high LDL. So when we think about the ketogenic diet, when I think about it, I think, okay, well, what are we doing to our cholesterol if we increase our saturated fat intake? Because a lot of saturated fat is found, well, a lot of meat products, I would say, like red meat, contains saturated fat, right?
Well, let's zoom out for just a moment. So in the book, I talk a lot about cholesterol, explain to people what LDL is, what HDL is, what cholesterol is, why cholesterol is important, why fat is important. And essentially, LDL and HDL, they are the transport system. They are the vehicles that carry fat and cholesterol molecules around the body. Fat and cholesterol can't travel in the blood without a vehicle, like a pod that they can sit in and be transported through the blood. They don't dissolve in the blood, so they have to be transported in pods. And so LDL and HDL, these are basically just transport pods that carry fat. Fat is energy to cells, and cholesterol molecules back and forth between cells. And cholesterol is a vital component of all animal cells, including all human cells. All cells need cholesterol. All cells are made from cholesterol. Cholesterol is a vital nutrient without which we would not be sitting here having this conversation. So LDL. So cholesterol is good. It's there for a reason. Fat is good. It's there for a reason. So what is this lipid panel telling us? When a person goes to their clinician, their primary care, and they get this lipid panel, most people have had this done multiple times. Typically, at least once a year, you'll have a lipid panel. This is one of the ways that your doctor is evaluating you for future cardiovascular risk. Like what is your risk for a future heart attack or stroke? And so one of the ways they do this is this lipid panel. So the lipid panel, as you said, it has the LDL, has the HDL, has triglycerides. That's the simple cholesterol panel will have total cholesterol and LDL. They're similar. It'll have the total cholesterol, which is kind of a way to estimate everything together. But the numbers that people will really remember are their LDL, their HDL, and their triglycerides. So most clinicians will focus like a laser beam on the LDL. And if they see it above a certain number, say above 100 milligrams per deciliter, for example, in the United States, they'll start to think, oh, this is risky. Do we need to do something about this? High LDL is a risk factor for cardiovascular disease. How do we get the LDL down? Should I maybe prescribe a statin medication to get this LDL down? Now, it's not that LDL doesn't matter. It's that it's the least helpful number on the panel. The LDL tells you almost nothing about your future cardiovascular risk. You can have a heart attack with very high LDL. You can have a heart attack with very low LDL. It's almost as good or bad as a coin toss. It's very, very weakly. It's a very, very, very weak predictor of future cardiovascular risk. That's not so with HDL or triglycerides. HDL or triglycerides are really good predictors good markers of metabolic health and good predictors of future risk. If your triglycerides are above 100 milligrams per deciliter, that is a red flag. If your HDL is below 50 and you're a woman and below 40 if you're a man, that's a risk, that's a red flag. Those need to be addressed. We don't have medications for those. And that's why doctors focus on the LDL, because you can lower your LDL with a statin medication. But a statin medication is not going to help you with your HDL, your triglycerides. The only thing that's going to help you with your triglycerides, triglycerides are fat in the blood, too much fat in the blood, is reducing the amount of carbohydrate in your diet, because triglycerides are simply excess carbohydrate that the body has to turn into fat. So if you are eating more carbohydrate than you need, then you can burn or store right away. We can't store much. We just have small storage tanks for starch and carbohydrate in our bodies. We have unlimited potential to store fat, of course, but we can store less than a day's worth of carbohydrate in our bodies for energy. If you can't use it or store it right away, if you can't burn it off or use or store it right away, all the rest of that carbohydrate, even if you're eating a zero fat diet, gets turned into saturated fat on purpose by the liver to be stored in your body. And that is on purpose because it's energy. You don't want to waste that energy. You can't store it as starch. You can't burn it because you've eaten more than you need. What are you going to do with it? The body has to turn it into fat. And it turns it into saturated fat, because saturated fat is the best, lightest, most compact, and most efficient way to store energy. Saturated fat is not a bad thing. It is simply a way to store energy, the way animals store energy for future use. So now a ketogenic diet, in some cases, will cause LDL to go up. And that scares a lot of people because they've been trained to think LDL causes heart disease. There is no scientific evidence that LDL causes heart disease. So that's thing number one. Thing number two is, yes, sometimes LDL goes up on a ketogenic diet. Sometimes it doesn't. Sometimes it stays the same. Sometimes it goes down. Sometimes it goes up by 10%. Sometimes it goes up a lot. There's a subset of people where the LDL on a ketogenic diet goes through the roof. It goes up by hundreds of points. That has been really scary to a lot of people because, again, we're taught to think of LDL, high LDL, as bad. And this tends to happen most often in lean individuals, younger individuals, athletic individuals. And there's been some wonderful research just published by Dave Feldman and his colleagues studying this group of people where they have very high LDL reactions to a ketogenic diet. These people were on a ketogenic diet for 5 years and they have very high LDL levels, and they looked directly at the arteries of the heart using coronary angiography and to see if they had any plaque. And they compared that to people who were not eating a ketogenic diet for 5 years and had much lower LDL levels. There was no difference in the amount of plaque in the arteries. If anything, there was even a trend towards less plaque in the people who had high LDL, very, very high LDL levels for 5 years on a ketogenic diet. So we're starting to see this hypothesis about LDL causing heart disease and ketogenic diets raising LDL being a bad thing. We're starting to see the science coming in is very reassuring. So when I see a patient with a high LDL, whether they're on a ketogenic diet or not, it's not that I ignore the LDL. I just
bypass it.
Just don't stop thinking. I'm like, hey, why is the LDL high?
Yeah.
And what else is going on? So let's look deeper. Let's get a coronary artery calcium scan. Or let's get an ApoB, or let's do deeper fractionation of the lipids to look at, okay, the LDL is high. Is it good LDL or is it bad LDL? Because there are different types. So we have to evaluate the LDL in context. It's not to ignore it, but to say, okay, let's look deeper and understand, is the LDL high for a good reason or a bad reason? Because a very healthy reason why an LDL could go up a lot on a ketogenic diet is that your cells are burning more fat for energy. So they need more fat to be delivered, and therefore they need more LDL pods to carry that cholesterol and fat to those cells. So LDL carries cholesterol and fat to cells that need it. If you're burning fat, which who doesn't want to burn more fat? If you're burning fat vigorously, you're going to need more LDL pods. So of course your LDL will go up. So there can be good or bad reasons for LDL to be high.
When I teach blood work and blood chemistry, I'm always talking about trends and ratios. And with LDL, I'm talking about the ratio between LDL and HDL. And if you've got enough HDL, which is pretty much, I describe it as the janitor who comes in and cleans up the LDL particles that are just spread all over the place, you could essentially have a high LDL if you've got enough HDL that can come in and clean it up. But I do believe I am with you on always doing further investigations, always doing a CAC scan. You can even look at Lp(a) to see if you need to really counteract that as well from a genetic standpoint. But it really shines a light on how much misinformation there is around this ketogenic lifestyle